Recovery after surgery really begins before surgery. It's very important to stay healthy and follow healthy habits. If you're smoking, you should stop smoking for at least a month or two before surgery. If you're overweight, it would be important to lose weight and get down to a more healthy weight. The healthier the weight you are at the time of surgery, the better your outcome's going to be. If you have diabetes or blood sugar problems, you should get your blood sugar under control and follow your doctor's recommendation. Elevated blood sugars can result in a number of postoperative complications, including infections and others. If you have other health issues, follow the direction of your physicians and try to be fairly strict with recommendations in terms of medications and diet and exercise. It's also very important to be active both before surgery and after surgery. In terms of reducing complications and healing up better after surgery, it's important again to keep your blood sugar under control, not to smoke, eat healthy, and be active. Being active can reduce the chance of pneumonia, which is a major problem after surgery, and can also reduce the chance of blood clots. And blood clots that break loose and go into the lungs is a major cause of complications after surgery, and being active can reduce that.